Good afternoon. I'd like to welcome the representatives of the island's media, as well as all of you who are watching and listening at home. Thank you for taking the time to follow this press conference. At the outset, I want to provide reassurance to the many islanders who've been asking across the weekend for details of how and when Jersey will exit lockdown. That detail and more will be made public by the end of this week. Other jurisdictions who are using what might be referred to as a traffic light system have indicated they will be moving to a red status, which includes allowing restaurants to open for takeaway service. This is the position Jersey is already in. And I fully appreciate the impact that the continued lockdown is having on the mental and physical well-being of islanders. The impact of isolation and loneliness should not be underestimated, especially for those in a vulnerable situation. So please continue to support one another and to make contact with our support services if you are concerned about friends, neighbours or family. And if you are concerned about your physical health, even if it's not COVID-19 related, please do seek medical advice as soon as possible, especially if you're suffering from new or unexplained symptoms. We want to be ready to tackle the next step as soon as possible. That's to provide additional freedoms whilst ensuring islanders are kept safe. We will always be guided by the expert advice of medical officers in deciding what is safe practice and when we can implement it. And we also want to outline the steps we will be taking to move our economy into recovery following this pandemic. So this morning I met with ministers and officers to begin the work of developing the recovery plan, which will outline the detailed initiatives needed to stimulate the economy, restore confidence, and ensure continued prosperity. In our press conference on Friday, I was asked if the government would publish additional statistical details about those who've died in our community as a result of COVID-19. And following agreement in the Emergencies Council, I committed to provide those details to the media and islanders this week. So from today, as promised, we will be publishing that additional data, including the place of death, the age ranges of the deceased, and their gender. Now, I know islanders want to be provided with as much detail as possible to understand the impact of COVID-19 on Jersey. I have said repeatedly that we want to balance providing this information with the right to privacy of the families of the deceased, allowing them to grieve in peace. And I hope that whilst this information will be of use to local media and our community, we will continue to show respect to those who sadly died and their families who are mourning in very challenging circumstances. A total of 19 islanders have now sadly died as a result of this pandemic. Of those deaths, 10 were confirmed through laboratory testing as being COVID-19 deaths, and 9 were presumptive coronavirus deaths. A total of 11 deaths took place within hospital care, 9 in the General Hospital and 2 in St Saviour's Hospital. Outside of the hospital setting, 7 deaths have occurred in island care homes and 1 within an individual's own home. 7 of those who sadly died were female and 12 were male. 11% of those who died were aged 60 to 69 years, 37% were aged between 70 and 79, and 32% were aged between 80 and 89, and 21% were aged over 90. I'd also like to provide an update on our testing and healthcare capacity. From the testing which took place over the weekend and today, we've now tested 2,545 samples for COVID-19 and have received 2,249 negative results and 283 positive results. Of those with positive results, 41% are male and 58% are female. The average age of those who tested positive is 54. And the results of 13 tests are currently pending. 161 islanders have now fully recovered from coronavirus, having originally tested positive. Of those who've recovered, 42% are male and 58% are female, and their average age is 48. 77 islanders are currently being treated in the General Hospital for a range of medical conditions. Of those, the number of coronavirus patients has reduced to 12. There are 120 beds currently available in the hospital, giving us an occupancy rate of 39%. So I thank you for taking the time to listen to this very short update, which I hope has been helpful to islanders and the media alike. I'm happy now to take some questions. For those on the radio, what we have is I have 5 journalists on a screen in front of me, and I shall go around them in the order I shall address them to. We'll give them 2 questions each, see where we get to, then do another once round, hopefully depending where we are on time. So, hopefully we have Elodie from Bailiwick, Ria from BBC, Ed Taylor from JP, Gary Burgess from Channel, and Harry Booth from 103. So can we go for Elodie first from Bailiwick?
Yes, thank you. Good afternoon, and thank you for taking the time. Chief Minister, you mentioned during a press conference on Friday that despite some issues, the ILGEN antibody tests are sufficient for the government's purposes. For what purposes exactly is the government intending to use this test? Is it simply for gathering data, or will they be relied upon to make a decision about who can exit lockdown and return to work?
So I think my initial understanding of this is when we get to testing, it gets quite complicated because you've got the PCR tests, which still do give us some information around the antibody side, and then we get the antibody testing, which is going to be for the wider population. So in respect to the question you've asked, my understanding is that the initial sample, which is going to be 500 families approximately, or households, which will be around 1,500 people. Part of it is going to inform the strategy. Part of it is to give us an indication at this stage of what the spread looks like in the community and how that correlates with the other information we've been getting. I think it's too soon from there to say that will then give the indication as to if you've been tested, does that mean we can automatically release you? That is the hope. But I can't confirm that today. I will know a lot more about it basically over the next 10 days, 2 weeks-ish, once we've done that first sample and once we've seen the information that's coming out of that. Second question?
Yes, there appears to be disagreement within the Council of Ministers over the best way to ensure the recovery of the economy. Senator Ian Gose told the Chamber of Commerce on Friday that he believes the best way to do this is to knock off a few percent of GST, but he said that's something no other ministers are supporting. Are such disagreements impacting the work of the Council of Ministers and what the plans for economic recovery that have been discussed so far?
So there's not been yet any specific conversations around if we did need to put taxes up, what that might look like. And I'm using the narrow definition of a tax rather than anything the government charges, I think, in that instance. So I think I suspect Senator Gorse in that instance, as the Assistant Treasury Minister, was probably raising an option rather than expressing a formal view from Treasury. Basically, whatever we're going to have to do around, and it's the balance between this is all about long term. This is about the economic recovery long term versus restoring the island's finances long term. And that is going to be a balance of measures. And there are some, if you actually look into the government plan that we did publish and it was approved by the Assembly last year, there were some pieces of work that we identified in that plan that were already scheduled for this year, which potentially could release some sizable funds to assist generally on a one-off measure that would assist with the financial challenges we are facing. Those wouldn't necessarily fall into the regime of tax-raising measures. So that's why I'm saying there's a balance of things we can be doing, and those discussions, or at least those really, really initial discussions, did actually start today with a group of ministers. They will then is going to formulate a structure very, very quickly. That's going to bring in, obviously, key members from the community, and that's then going to feed into the council ministers. As I said, that's the longer term. On top of that, this particular week, which, as I said, we'll hopefully be announcing on Friday, will be the framework around actually starting to ease the lockdown. So there's 2 parallel pieces of work. One is easing the lockdown, and the other one then, which is going to take longer, is planning for how we'd restore the island's finances and handle the economic recovery.
Just to clarify, Senator Ghost mentioned, I think, lowering GST rather than raising it. So can you adapt your answer to this, please?
Well, I think the same principle is that this comes down to the issues around what does economic recovery look like versus what do we need to do on restoring the island's finances, and that's going to be the issues we're going to have to face but I'm going to say that's going to be over the coming weeks in terms of bringing that package together. So that piece of work is starting. As I said, the other focus for this week, though, is the short to medium term bit of how we come out of the lockdown. And sorry, what I should clarify as well is that how we come out of the lockdown and how quickly obviously it impacts upon the economic recovery side. And that's why we keep emphasising there is a balance, and obviously we're also always following the medical advice that we received to date. Okay, Ria.
Yes, hello, Ria Wolstenholme from BBC Radio Jersey. You mentioned the development of the recovery plan to move into the economic recovery. How are you planning on helping businesses to plan for the future and have businesses approach you with new business models in what we are calling the new normal of what's going to happen after this?
So the likely structure, and please note this is all subject to finalisation and also approval, obviously, by relevant ministers and council ministers, would, I think, be something similar to what I, certainly on a larger scale, to what I saw around when we were dealing in 2005 with the whole 010 black hole and GST. That was when I first started politics. And so what you have some working structure, some working groups effectively of related ministers. You then have various working groups formed by, in that instance, mainly financial services people, but with also some economic advice coming through, because that was fundamentally mainly a fiscal issue and financial services issue. What we're facing now is going to be a wider set of issues. Therefore, we're going to have a wider engagement with that community. But that's kind of that process that we need to start with, in my view, the economic side, but then we're going to have to widen that out further to cover community, to cover social matters and all sorts of other aspects. That, if you like, structuring and going away, we've given officers certain suggestions today, which they'll be coming back to us over the next few days. But I'll just make this point about balance. That's a medium to longer term issue. The short to medium term that we're focusing on for this week is also how do we ease out of lockdown as well.
You also mentioned that that Jersey is already in a red status of having restaurants open for takeaway service. Is that a positive thing? Should we look at that positively? Does that mean that businesses are going to be okay in the long term, like you say? Well,
I think what that hopefully indicates is that we didn't go as far as certain other jurisdictions in the lockdown measures initially. So we, and it was very clear actually when we were discussing this with the medical professionals, they were very keen for all sorts of reasons that, for example, takeaways could still operate. We also sort of raised the query, well, can a window cleaner still operate? And the answer was, from their perspective, was yes. So we never closed down the type of individuals who can self-isolate, socially distance basically, and work, or as little as possible. So those so like the window cleaners were allowed to carry on, and we felt that was important. Now some jurisdictions are therefore coming their release, or their first stage of release is coming to where we are now, where we've always been. Now looking ahead, I think one of the biggest issues for any businesses has been the impact on cash flow, on customer base, all those type of things. So I think it's almost certain that not every business will be okay as a result of the crisis we've been through. We are trying to do as much support as we can, and as has been alluded to, the meeting that Senator Gorse and Senator Farnham had was basically the decision having been signed off, which was the release of the biggest support package this island has ever seen for business, which was signed off and agreed on Friday.
Thank you very much.
Did you have a second question? Sorry.
That was my second.
That was, sorry, apologies. I was getting too carried away there. Ed, JP.
Yes, good afternoon, Minister. During the screening last week, it was suggested that given how flat our infection curve has been, that we could have locked down later in hindsight and lessened the effect on businesses. Do you agree with that remark?
I'm always a bit cautious about looking backwards when you're in the middle of a crisis as to what you could or could not have done better with hindsight. We make the point that the decision to go into lockdown was on the basis of the medical advice we had, and that's the medical advice that was current at that point in time. And the real concern from what was being seen in other jurisdictions was that you could see the curve starting to loom. We had a slight dip actually in data that was coming through to us, and therefore it was felt on a precautionary basis it was better to go in. And as I said, bear in mind relative to other jurisdictions, the lockdown we imposed was not as severe as was the case elsewhere. The fact that we're actually starting to talk around easing lockdown is probably an indication that to date we've been successful, and I don't think we should lose sight of that. There's been consequences to that, but it's always been based on the advice and what one's been seeing in the other jurisdictions. Second question.
In the Isle of Man, they've had about 308 cases now and 18 deaths, which are pretty similar figures to ours. And on Friday, they announced that they were going to lift certain measures, such as not having a time limit on how long you can stay outside the house for, and allowing non-essential journeys. With May the 11th coming up, is there any idea about what this first phase of easing lockdown could look like at all?
I'd rather not comment now on the basis of being hopefully some of that detail on Friday. So this is going to be, it'll be a framework. It'll be around what individuals' measures might look like relative to where we are and what the next steps will be. It isn't rocket science to work out. It will be a phased approach because that's what most jurisdictions, if not every jurisdiction, seems to be following. But I'd rather comment on the details, or at least that level of detail, on Friday once particularly Emergencies Council and Council Ministers have had sight of the final proposals. Okay. Gary.
Chief Minister, you've not so much sort of flattened the curve as absolutely killed it off, really. Next to no new cases each day, an average of around 5 a day. And as you highlighted, the number of people recovering and the number of people currently with it is actually relatively very small, around 100 people with coronavirus at the moment, and 70% of hospital beds empty. Yet, despite all of this, on Friday, you warned there could be a hurricane coming. I just wondered, is there something you're not telling us, or were you just musing aloud?
No, what I said is that it's like we're in the middle of the sunshine, but we know there's a hurricane on the other over the horizon that we can't yet see. And the difficulty we've got, I then use the analogy of a wave actually just building up. And the problem is, it's potentially building up. We hope the measures we put in place have been enough. But because we had, as I've referred to, a slight delay in sampling, that we're still slightly cautious. We think we're just about to start coming out of that now, as to whether that has skewed the results. And that's why we are taking measures to ratchet up sampling. I believe we are in the position that we can responsibly talk about easing, but we've got to also make sure that we ease in a really responsible and careful manner, just in case of the risk that it does actually sweep through. And that's this ongoing balancing act that we've been having to maintain all the way through. So yes, on the basis of the figures we had last week, I think we should be very pleased with ourselves. I'm naturally a cautious person. Bear in mind, this is always a fast-moving set of events. You're not operating in perfect data. You're not operating with perfect information. And that's why we're being cautious. That's why we can look at the results and say, yippee, we could open everything up tomorrow. I don't think that would be the right result. You've got to be very responsible about how you ease it out, because if you get it wrong, there can be consequences. Second question.
I know your lockdown exit plan is due at the end of this week, but for people listening on BBC Radio Jersey right now and watching you on ITV channel television tonight, I just wonder, in broad terms, looking at the longer term, the next, say, 18 months before realistically experts say a vaccine might be coming, what do you think life will be like in Jersey? Can you paint a picture for us? Is social distancing how it's going to be? Is shielding the most vulnerable how it's going to be? I just wondered, just in broad terms, could you paint a picture just to help manage people's expectations? Because I think incorrectly, likely, some people think phasing out lockdown just means a return to business as usual, and that's clearly not going to be the case.
I think what one can say is that the strategy of contain, delay, shield is going to be with us for quite some time. But what we keep going back to that point of balance, of risk versus responsibility, and of the impacts this all has on people's mental health. And I think, having said all that, what I think is going to be with us for the longest, and I can't give you a time frame on this one, is the social distancing. I think that's likely to be the last measure you will see released. As to when, I probably won't be commenting on that on Friday, and I certainly won't be commenting on that now. But I think that if that gives you a framework, as I said, it'll be a phased approach, and we'll put some more information out on Friday on that.
Just a very cheeky follow-up to that second question. Your own chief executive has said he doesn't expect it to be longer than 12 months. Do you?
I think it's all going to be based on how long a vaccine can come through, what the medical advice is then saying at that point. And for me, that's a bit too early to say. I think in the past, we've said 6, 12 or 18 months. I think that still remains the kind of indicative time frame. So that's consistent with what the chief executive is saying. And as I said, we're operating in that particular part of the world, we're operating in a world of uncertainty and information that's going to change daily. And that's really all I can say at this stage. Harry.
Good afternoon, Chief Minister. With the additional data that you've told us about today, you said sadly 7 people have died in care homes. Are you able to say how many care homes these 7 deaths have happened across?
Oddly enough, I don't have that information to hand. I will see what I can find out and come back to you probably for Friday's press conference, if not before. As I said, I know it's a total of 7 care homes. And bear in mind, and I know there's all sorts of issues around that, I'll just reiterate the point of this ongoing balance between the privacy of the individuals. You know, there are human beings and families behind every one of these numbers, versus the public interest side. But I'll see if we can identify the further information you're seeking within that, trying to respect those balances.
Do you know if it's more than 1?
Off the top of my head, I don't. But can I come back and confirm one way or another to you separately?
Right. Just the reason I asked that is Ed mentioned earlier about the Isle of Man. I know a large percentage of deaths have been in one care home there. I think it was, last time I looked, it was 13, and an investigation is taking place into that. So I think for transparency, that's important.
Can I say I'm not aware of it being concentrated on one. That I would say that I receive lots of information across my desk daily. So if it occurred some time ago, it might have just been supplanted by some other information. What I can also say, which actually is to date has given me a lot of confidence, is that you recall I said I went to visit the hospital, the command centre last week on Friday, I think it was, and we were shown the very good work that was happening between the sort of primary and secondary care areas, i.e. the GPs. So the fact that we brought the GPs in appears to have worked very, very well, and has also helped in dealing with cases as they've arrived in the community and in particular in care homes. That's my understanding. And that, to an extent, I think has been something that seems to be mitigating any issues that arise now. I can't tell you about the past before they were brought in, but I'll see what information we can get you.
Brilliant.
Okay.
Thank you. Sorry.
Yep.
Can I ask my second question? Sorry.
Yep.
Just on the household survey, I know a text message was sent out to islanders this past weekend on that. Can you give us more information on how many people have responded to that so far, and from the results you've had, what that's really telling you at this moment?
What I'll do, and I'll try and answer that question before we finish, okay, because I'm sure somebody will bring that number to me. I've got 10,000 in my head, I have to say, but in terms of people who've responded, but I'd like to verify that before I confirm.
In terms of what it's telling you, though, in terms of response, in terms of what you do going forward, what can you say what it's telling you?
So again, this is part of the whole monitoring process that we're putting in. This is around trying to identify. Bear in mind, it's a self-diagnosis, if you like. It's trying to give us an indication of people who think they've had COVID-19 symptoms. We can then start correlating that with, once we start doing, I believe part of that information is being used to inform us as to who we select for testing for the antibody testing, which hopefully will start in the next 10 days or so. So that will be part of the factor. It's also been used to put in, if you like, on the map of the island, which is just giving us an indication of where, if that's particularly relevant, where clusters have occurred or seem to be occurring. But again, as I said, my update that I had on that was before the kind of surge we'd had of quite a lot of islanders having filled in the information. So I haven't seen the latest update since the kind of weekend. I think the last update I had was probably early last week.
Okay, and just a quick follow-up before I let the others back in terms of the importance of people taking part in this, in terms, as you mentioned, clusters, getting people the antibody tests that need them. I suppose, as you must say, that's quite important then, that people come forward if they have these symptoms so they can get tested as quickly as possible.
No, absolutely. And basically, so, the message has always been ring the helpline and they'll direct you in the right way as to whether you need a test or what you need to do. Just through the wonders of magic of technology, or even a pen and a large sheet of paper, it's 10,150 islanders have completed the survey to date.
Thank you.
Okay, right. Shall we just go around once more with Elodie?
Yes. The government strategy has been focused so far on shielding vulnerable islanders, but the statistics released today show that the majority of deaths have been people in this category. What is being done to ensure that there are no more cases within care premises, particularly those run by the government?
Well, to an extent, I think I partially answered that question earlier, which is the measures by bringing the GPs into the system has made a real difference in how we can treat people in the community without bringing them into hospital. And that obviously applies to the care homes. I think the sad fact is that whilst we are trying to do our absolute best to shield the people who are vulnerable in the community, part of that sad reality is, which is demonstrated by the statistics, is that the ones who are still likely to suffer from this are the vulnerable in the community. And that's why a lot of the measures we've taken have been steered to try and protect them as much as possible. Ria?
Yes. In the figures that you released talking about the number of deaths, there was a number of presumptive deaths that hadn't been confirmed. When will they be confirmed if they were COVID-19 related?
From memory, and this is an issue on, obviously I'm not a medic, but from memory, the difference is that it depends how it's recorded on the death certificate. So some will have been positively tested and identified as having COVID-19, which is the 10. I believe the probable, hang on, I'll just read a note actually. Probable COVID-19 means the person either tested negative in laboratory testing or was not tested, and the cause of death was certified as probable COVID-19 based on their clinical history, examination and investigations. So in other words, so where we're saying they've definitely died of COVID-19, that's backed up. It says it's laboratory proven. That's been on the basis of a lab test. Where they've been probable, for whatever reason, they weren't tested, and therefore, being really simplistic around it, I therefore assume it's effectively the GP's opinion that it is a probable cause rather than a definitive cause. And you will recall that what we did on our, I think it was 2 weeks ago, we defined how we were going to count basic deaths that arise during the course of this crisis. And if there was a probable in there, in other words, it was noted anywhere on the certificate, it would be included in our figures.
Okay, thank you.
Ed?
Thank you, Chief Minister. At the moment, anyone wishing to leave or come into the island has to seek authorisation from customs. And you said before that social distancing is a measure that's likely to be in place for quite some time. Is it likely that those two measures are going to go hand in hand? Are we going to see these travel restrictions in place for quite some time longer?
I think it depends on your definition of quite some time. Again, a variety of factors, not an easy subject. Number one, it'll depend on what's happening on other jurisdictions around us and where we think everybody is in terms of the spread of the virus. There's still potentially the threat of second waves, all that type of stuff. Number two, the reality will be it depends on when essentially the likes of British Airways and EasyJet start flying their fleet again, and that will also depend on what airports are actually able to open, because it will depend on their ability to social distance passengers as they go through. In terms of so I think for certainly the next few weeks, I would expect the social self-isolation and the 14 days and all that type of stuff, those measures to remain in place for anybody flying into the island. Beyond that, it's too early to tell, because as I said, it will depend on what's happening, for example, in the United Kingdom, and it depends on the medical advice we are getting. And again, where we are on the curve. Gary.
Chief Minister, can you be really clear on what the Nightingale is for? Because there have just been some ambiguous or contradictory statements. Initially, a big intensive care unit, then a step-down facility. I noticed today the government called this a wing of the General Hospital. I'm getting a lot of questions about this, so I think it'd be really good to get a clear answer. Is it for post-intensive care COVID patients recovering? Is it for non-COVID patients to get care so the Nightingale remains free of COVID? Will it only be used when the General Hospital runs out of beds? Just precisely what is the Nightingale for?
So the initial intention was, when we commissioned it, was for COVID-19 patients that didn't need invasive treatment. Now, I suppose actually a more fundamental one was to give us the resilience and the bed capacity within the health system. I think take that as the principle. Now, if as we move through where we are on the curve, how that goes through, depending what happens as we ease through ease out of the lockdown very, very slowly. If the medical opinions change, then it may well be that we flex the use. Essentially, what we've got to say is we've got two buildings which have got good medical capacity in them, and then allow us to have flexibility in how we treat patients. So one of the other issues you've got to bear in mind in all of this is that there are, and that's actually why I referred to it in my statement earlier, you are sometimes getting people who don't have COVID-19, coronavirus, but who do have other issues that ordinarily they would be going to hospital about for treatment. And what we to date appear to be seeing is that those people are worried about going to hospital when they shouldn't be, and are not receiving the treatment they should be receiving. So depending where we are, how things look going ahead, and it's all a little bit crystal ball to an extent, but that's why getting the data is always important. You might want to flex that use slightly, whereby you can actually make sure that the hospital is really set up to deal with normal patients coming in as well as coronavirus, and that may determine then the use of the facility down at Millbrook.
So I was going to say, just to be clear, in absolute layman's terms, it'll be down to the medics at the point it's needed to determine its need.
Yes, because it's all about flexibility within the health system.
Great, cheers.
Okay. Right. Harry Booth. Also by the magic of technology, Harry, we've got an answer for your last question, which is that 8 care homes are the ones that have been affected by coronavirus.
Okay, thank you. My final question, off the back of Gary's, really about the Nightingale Hospital. When that does open, we know that a lot of appointments for other things have been cancelled because of the coronavirus pandemic. Will the hospital, the General Hospital, be able to reinstate kind of appointments that are currently on hold when that Nightingale hospital opens? And can you say which appointments will be reinstated for people who obviously had appointments put off that they're very concerned about?
No, so I can't give you precise detail, because I'm sure it will always depend on the circumstances. What I said in my statement earlier was that if people do have a non-COVID-19 condition that they're concerned about, is to seek the medical advice they would normally have sought. So if they've been speaking to their GP, or if they've been whoever they've been speaking to, it's worth, I don't know whether it's email or telephone, whatever it is, just getting in contact with them just to discuss the situation through with them. And that can then determine whether they still should be staying on hold, whether there's something that can be arranged in the next few weeks, or whether it's something even that can be done now. So, sorry I can't get into the specifics. It really does depend on the circumstances.
Yeah.
If it does also help, by the way, I think it was Harry, you were asking me about the survey again. In fact, the latest update is we've had 16,000 islanders have responded.
Okay. Thank you very much.
Okay. Right, time-wise. Should we do one more round each and then call it a day? Okay, we've got a thumbs up. So, Elodie.
Yes, it's been mentioned several times that to replenish public funds used as part of the government's response to the current crisis, taxes will have to be increased, yet we still don't have a lockdown exit plan. Isn't it a bit premature to talk about how funds will be recovered when we don't know when lockdown will end? And do you not agree that the funds, having been built over several years, should be recovered on the longer term rather than the short one?
I think they probably try to think the easiest way to answer it, because it's actually quite a complicated question. It is a jigsaw and it is a balance, and what that means is that the jigsaw bit is that any financial recovery from the public sector side is almost going to be a mix of measures, and I can't tell you what those measures would be like, because that's definitely premature. I think, but we've then got to go back to the point we've touched on it in the earlier questions about the economic recovery, and then, as I said, I would call it the island community recovery as well, which is going to be about social and things like mental health as well. In terms of is it short and long term, again, it's going to be the same. Apologies, I've obviously been talking too much. I'm losing my voice. You're not going to restore the island's finances to where they were in a year, and then you've got to then work out is what is that's in my opinion, obviously. What you then got to work out is what is a reasonable time period to do it. But I think for me at this stage, subject to all the approvals that we need to get, I would be in the medium to longer term on that outlook rather than the short term. I think that's probably all one can say at this stage. It's a little bit premature. Part of it as well, bear in mind all the caveats about making sure we do everything based on the medical advice, is as we ease lockdown, then the financial impact and the economic impact in theory does ease. And that's the other balance between that, the health position we face, versus any long-term issues, health issues that arise out of being in this position in the first place. Okay, Ria?
Yes, thank you, Chief Minister. You mentioned that social distancing is likely to be the last measure we see released. And in terms of your recovery plan, and like you just said, how the phase will help this and having a phased reopening and going back to normal as such. So which businesses are going to be opened first in that sense, and how will social distancing impact that and the economy?
Again, I don't think I can get drawn on that one today. We'll have a lot more, hopefully a bit more clarity on Friday in that area. But whatever happens, it'll be the overarching requirement will be the ability to maintain and enhance, if anything, maintain social distancing. And by that, I think there'll be consideration as to can businesses social distance, what we do to ensure that we don't get large groups gathering in social circumstances, things like that. So I think at this stage, I don't want to put anything out on the table, but the principles of social distancing will be there, have got to be in there as part of that overall consideration and the medical advice we receive. Ed?
Yes, you touched before on the antibody tests.
Yeah.
I was just wondering, someone who hasn't previously tested positive for coronavirus, would they be eligible to receive one?
I'm going to say I haven't actually thought that one through, but I suspect this is very much a personal view, and it'll be one of those questions I ask of the testing regime when we next get the next update, which will either be tomorrow or Wednesday. I suspect the answer must be yes, because if by testing positive, we've said that's what's called the PCR tests, which are effectively done through the laboratory, either on island or off island, then we know that's a limited number of people. We know that's only around, 283 people. And on the basis we're going to be testing 1,500, then logic says they must have therefore not been tested positive for the virus. But we just suspect that there is the rule of thumb that we've been operating on previously is that for each person that has been physically tested positive, there's 10 out there who've had it and may or may not have realised it, or certainly didn't have it seriously enough to go to the GP or come into hospital. So I think from a logic point of view, unless I'm corrected otherwise, it must be that there will be people who've not tested positive who will be checked for the antibodies. That again will then start informing us as to, that the reason we're doing a 1,500 is to sort of identify these kind of issues and anomalies and see, and that will be included in the structures for gathering the data, which don't underestimate. Okay, Gary?
Chief Minister, where are the experts? We see Nikki Brink appearing publicly in Guernsey 2 to 3 times a week. We see Chris Whitty and Jenny Harries in the UK on a near daily basis. Ivan Muscat's popped his head up a couple of times, and you often refer to his modelling, but we never get to see or ask questions about those workings out. We just get a couple of graphs where the peak mysteriously shifts every now and then. I just wondered where the experts are.
I think the very short answer is doing the kit evaluation and essentially getting us into the best place to get the testing regime done. That's ultimately what we want them doing. But I do take the point, and I will at some point try and arrange for somebody medical to be coming in front of you to allow you to get the kind of operational questions, because I take the point. But no, the focus has very much been on allowing them to get on and do their job, which is what we're all about. It's about trying to get the island in the best place. To date, I think we should be proud of where we all are.
I think it'd be appreciated by a lot of people, not necessarily the shop floor operational stuff,
No.
but more actually at Ivan Muscat level, just how that modelling works. Because I know many people are speculating, and the one thing none of us wants right now is speculation.
You're right in terms of not speculating and being absolutely responsible how we handle the crisis. I think it's absolutely correct. But thank you. And I'll see what I can do. Harry.
Right, my question was quite similar to Gary's actually. Off the back of that, in terms of the graph, I mean, we see the data in terms of if we reverted back to social distancing, we could have by mid-June, I think it was, around possibly 800 new cases a day. And I think that just kind of took people a bit by surprise, the evidence to show that. And off the back of that, with not hearing from Dr. Muscat, I think that's important to kind of show where that information is coming from, do you know? Okay,
I mean, as I said, my understanding is that certainly Dr. Muscat is feeding into that. There's basically a statistical team that take all these modelling and put it into what was first developed, and then obviously that continues to evolve as they refine measures. But no, I do take the point, and I think it would be useful, as I said, for all sorts of operational questions, for occasionally you to be able to ask them questions direct. So I'll see what I can do, but always go back to the point. Even though it feels like it's been a long time, we're still in relatively early days. The more prepared we can be, the better we are. What I don't want to be in the position is to take somebody off, and they'll have to prepare for it and all that type of thing. And because of that, we just get delays, because it then accumulates, and then suddenly we've actually missed something, which actually becomes rather important in 3, 4, 5 weeks' time. But anyway, okay. On that note, can I just draw a line? Thank you very much, all the media present. Thank you to everybody listening and watching, and later watching, and also watching on Facebook. And as I said, I think there's another ministerial update on Wednesday. I will be doing at least one piece to camera during the week, and then there'll be another press conference on Friday, where at that point, hopefully, we'll have the updates as to what the framework will look like for starting to ease on lockdown. Thank you very much for listening. Thank you for your patience. Please keep maintaining the lockdown. It's the best way if we can get the island through this, and we should be very proud of everybody and all the teams who've been working together to get us to this point. But thank you for listening, and we'll close the press conference at that point. Thanks so much.